Risks and side effects of laser eye surgery. LASIK. What is LASIK surgery? LASIK stands for laser-assisted in situ keratomylesis. This refractive surgery reshapes the cornea with an excimer laser. LASIK eye surgery is a very popular and commonly performed laser refractive surgery to correct vision problems. Laser-assisted in situ keratomylesis, LASIK, can be an alternative to glasses or contact lenses. Why it's done? LASIK surgery may be an option for the correction of one of these vision problems: nearsightedness, myopia. When your eyeball is slightly longer than normal or when the cornea curves too sharply, light rays focus in front of the retina and blur distant vision. You can see objects that are close fairly clearly, but not those that are far away. Farsightedness, hyperopia. When you have a shorter than average eyeball or a cornea that is too flat, light focuses behind the retina instead of on it. This makes near vision, and sometimes distant vision, blurry. Astigmatism. When the cornea curves or flattens unevenly, the result is astigmatism, which disrupts focus of near and distant vision. How it is done? During LASIK surgery, a special type of cutting laser is used to precisely change the shape of the dome-shaped clear tissue at the front of your eye, cornea, to improve vision. In eyes with normal vision, the cornea bends, refracts light precisely onto the retina at the back of the eye. But with nearsightedness, myopia, farsightedness, hyperopia, or astigmatism, the light is bent incorrectly, resulting in blurred vision. During LASIK eye surgery, an eye surgeon creates a flap in the cornea, the transparent, dome-shaped surface of the eye that accounts for a large part of the eye's bending or refracting power. Then the surgeon uses a laser, B, to reshape the cornea, which corrects the refraction problems in the eye, C. Is LASIK eye surgery painful? Fortunately, LASIK eye surgery is not painful. Right before your procedure, your surgeon will place numbing eye drops into both of your eyes. While you may still feel a little bit of pressure during the procedure, you should not feel any pain. Your surgeon may also give you some medication, such as Valium, to help you remain calm and relaxed during the procedure. After the surgery, it is common to feel a slight itching or burning sensation in your eyes, but these should go away quickly. Am I a candidate for LASIK eye surgery? The good news about LASIK is that it's fairly inclusive, meaning many adults are eligible for this procedure. Current FDA-approved parameters for LASIK state that a patient must have up to -12.00 d of myopia, also known as nearsightedness, up to +6.00 d of hyperopia, also called farsightedness, up to 6 diopters of astigmatism, cylinder, which is a common imperfection in the curvature of your eye. Your doctor will evaluate the shape and thickness of your cornea, the size of your pupil, and check for refractive errors such as myopia, hyperopia, astigmatism, and any other eye conditions before the operation. Why you should not get LASIK? Make sure you don't have any conditions that might result in complications or poor outcomes of surgery. These include an eye disease that results in a progressive deterioration of your vision and thinning of your cornea, such as keratoconus. In fact, if keratoconus runs in your family, even if you don't have it, be very cautious about elective eye surgery. Inflammation, such as keratitis or uveitis, and infections, such as herpes simplex, affecting the eye. Eye injuries or eyelid disorders. Dry eyes. It is important to know that if you have dry eyes, LASIK surgery may make the condition worse. Large pupils. If your pupils are large, especially in dim light, LASIK may not be appropriate. Surgery may result in debilitating symptoms such as glare, halos, starbursts, and ghost images. Glaucoma. The surgical procedure can raise your eye pressure, which can make glaucoma worse. Cataracts. It is not recommended to receive LASIK if you have cataracts. Who is the ideal candidate for LASIK? Be at least 18 years old. Not have an autoimmune disease, which can make it difficult to heal after surgery. Not be pregnant or breastfeeding. Elevated hormone levels during pregnancy can affect the shape of your eyes, making it better to wait for surgery until your hormone levels return to normal. Have healthy eyes, including no history of cataracts, a chronic dry eye condition, or glaucoma. Can you go without your contact lenses for several weeks before surgery? You'll have to completely stop wearing your contact lenses and switch to glasses for at least a few weeks before your surgery. Contact lenses distort the natural shape of your cornea, which can lead to inaccurate measurements and a less than optimal surgical outcome. Your doctor will provide specific guidelines depending on your situation and how long you've been a contact lens wearer. How much does LASIK eye surgery usually cost? On average, LASIK costs range between $2,000 to $3,000 per eye. Is LASIK covered by insurance? The short answer to this is no. Most insurance companies consider LASIK and other corrective laser eye surgeries to be an elective procedure, so it is not covered. There are certain circumstances, though, where your insurance company will cover refractive or laser eye surgery. For example, if it's needed to correct errors as a result of injury or surgery. What does recovery from LASIK entail? About a week after your surgery, you'll meet with your doctor again to make sure your eyes are healing properly. At that visit, your doctor will determine if more follow-up visits are necessary. While you will be permitted to work the day after your procedure, it is recommended that you take a couple of days off to rest. You should also avoid wearing eye makeup for a week, as well. Once you resume wearing makeup, you should use new products to avoid the risk of infection. Some patients may experience a spot of blood on the white of the eye called a subconjunctival hemorrhage. This is common and can take up to 2 weeks to resolve. When will I see results from LASIK eye surgery? Immediately after the LASIK eye surgery, if you are nearsighted, you should begin to see things from a distance that you couldn't see before. While your eyesight will likely be fuzzy and hazy initially, it should stabilize and continue to improve within the first few days after surgery. It is not uncommon for your eyes to sting a bit or to feel a little gritty and slash or sensitive to light after your procedure. After 4 to 6 hours, patients may feel relatively comfortable with their vision. Most patients feel very comfortable with their new vision by the next day. Are there any risks or side effects associated with LASIK eye surgery? While complications that result in a loss of vision are rare, certain side effects, particularly dry eyes and temporary visual disturbances, are fairly common. But these usually resolve after a few weeks or months, and very few people consider them to be a long-term problem. Still, there are some side effects of LASIK, such as dry eyes. LASIK surgery causes a temporary decrease in tear production. For the first 6 months or so after your surgery, your eyes may feel unusually dry as they heal. Even after healing, you may experience an increase in dry eye symptoms, glare, halos, and double vision. After surgery you may have difficulty seeing at night. You might notice glare, halos around bright lights or double vision. Under corrections. If the laser removes too little tissue from your eye, you won't get the clearer vision results you were hoping for. Overcorrections. It's also possible that the laser will remove too much tissue from your eye. Astigmatism. Astigmatism can be caused by uneven tissue removal. It may require additional surgery, glasses, or contact lenses. Corneal ectasia. Corneal ectasia is one of the more serious complications and occurs because of progressive myopia due to steepening of curvature of the cornea. Flap problems. Folding back or removing the flap from the front of your eye during surgery can cause complications, including infection and excess tears. The outermost corneal tissue layer, epithelium, may grow abnormally underneath the flap during the healing process. Vision loss or changes. Rarely, you may experience loss of vision due to surgical complications. Some people may also not see as sharply or clearly as previously. How long does LASIK's result last? A meta-analysis discovered that 97% of patients achieved uncorrected visual acuity, UCVA, of 20/40ths, while 62% achieved 20/20ths. LASIK can last a lifetime, 20 years, or 10 years. The lasting effects of the procedure depend upon multiple factors, including the age of the patient at the time of the procedure, and medical conditions that one may develop as one ages that may affect eyesight. There is a procedure called LASIK enhancement that acts as a follow-up enhancement procedure for those who have undergone LASIK and have experienced degenerated vision. This procedure ensures that even if the patient's eyesight worsens, corrections can be made to get back to clear sight. The final decision from 1988 to 2008, a properly conducted, well-designed, and randomized clinical trials found a 95.4% patient satisfaction rate among LASIK patients. However, some people with poor outcomes from LASIK surgical procedures report a significantly reduced quality of life because of vision problems or physical pain associated with the surgery. Some patients need to wear contact lenses or glasses even after treatment. When it comes to LASIK eye surgery, there are no right answers. Carefully consider the factors outlined here, weigh your preferences and risk tolerance, and make sure you have realistic expectations. Talk to an eye surgeon in whom you feel confident and get your questions answered. In the end, if it feels right, then proceed, but if it doesn't, don't rush into anything. May you stay healthy and have abundant of happy life. Please like and subscribe this channel for more health-related videos. Thank you.